Today we'll be talking about menopause, and we will also be starting a series of topics or conversation about menopause. And for me, menopause seems to be dear to me. Most importantly, the fact that if I remember very well, my mom at that time, were presenting symptoms, and I didn't understand at that time, when she asked you to, can you please turn on the fan? Can you please open the windows? Until I became a practitioner and I kind of began to understand what my mom was going through at that time. She definitely was, at the age of her menopause, and that's why she was going through, those night sweats and symptoms that some of us do already know comes with menopause. And also, when I started working as a practitioner and seeing a couple of female patients, sometimes in their early 40s, right? So between 40 to 45, and having these, symptoms of night sweat, hot flashes, and these are the symptoms we kind of most of us are used to, right? When we talk about menopause, these symptoms quickly come into mind, right? The hot flashes, the night sweat, right? And some of them also have the low mood, the mood swings, the low libido, in a couple of those symptoms, what we call the vasomotor symptoms, right? And I remember very well one female patient I saw. She was in her early 40s, and she probably thought maybe whatever she was going through could be stress, because at that time I remember, she had mentioned to me she was looking for a job, right? But the symptoms she had told me about, the night sweat, the hot flashes, the forgetfulness, right? And for me, as much as I remember referring her, to social work for them to help her with job search, I also decided to kind of, run some labs to see if she could be presenting with what we call the early menopause, which is usually between the early 40s, between 40 to 45. Um, with me asking her questions with history, she was still having her cycle, her menstrual cycle. Her menstrual cycle had not ceased. It's just that she was having the symptoms, the vasomotor symptoms that we just spoke about. So I felt like it's about time, general practitioners, in most importantly in primary care, start kind of having a discussion with patients, especially during history taking when they tell you that they're having symptoms, right? They probably might still be having their menstrual cycle. Unfortunately, this doesn't seem to be the situation, I would say, nationally and also worldwide, right? Where, first of all, females themselves sometimes are confused, when they get to that stage. And sometimes if they are having early menopause, they're not sure, is it early menopause? Is it perimenopause? We will talk about this in details, at some point. And because they themselves, are, they're not sure what is going on, they can't even explain very well to their general practitioners or OBGYN, right? And sometimes if they do, the general practitioners themselves, sometimes also not sure, and sometimes they come up, because I also practice in primary care, we come up with a whole lot of diagnoses. We try to see if, for example, if patient is talking about low energy, we will do the ion panel test to find out is patient having anemia. If patient is saying things like, oh, her libido has gone down, we're trying to now play the role of therapist, right? Trying to encourage the patient, to go out more with their partner, to kind of talk to therapists, to add some spice, to their marriage. And sometimes we forget that it probably could be hormonal imbalance, right? It could be that if we had taken the time to ask more questions, we probably would have come to the conclusion that, these patients probably might be having maybe low hormones level. It could be low estrogen. It could be low progesterone. It could be also low testosterone. We will talk into details. These these three hormones. But today I just wanted us to kind of demystify a little bit, and start the ball rolling. And we will, like I said, we're having a series of conversation about menopause, the symptoms, and also if blood work is needed. Thank